Last video we said that mechanical ventilation or positive pressure ventilation leads to decrease in LV after load. And remember we said that ventricular pressure should be equivalent to pericardial pressure and transmural pressure at any point. So the ventricular pressure, which the result of the ventricle systole and contraction, need to produce a wall stress or a pressure here, a transmural pressure, to make this equation valid all time. So this is the work that the ventricle need to do, the transmural pressure or the afterload. Remember, these are squeezing force and this is expanding force. Just to quickly, so when there is increase in the pericardial pressure, that means the ventricle needs to produce less transmural pressure. That means less work and less afterload. If you still get confused, just remember one thing. When there is increase in thoracic pressure from mechanical ventilation, that is what? Squeezing force. So just remember this, if cares. So this positive pressure squeeze LV, which means help eject the blood and help decrease LV afterload. If you want to forget about all of this, just remember there is increased pressure in the chest. This increased pressure will squeeze the left ventricle to help ejecting the blood, and of course that means decrease the work and decrease LV afterload. Now how about RV, right ventricle? Right ventricle, you could say should be the same, right? But there is another issue here. Basically, this is the alveolus and this is the capillary. When we have a positive pressure ventilation, we fill this with air that increase the alveolar pressure, that will lead to expanding of the alveoli and squeezing of the capillary. Squeezing of the capillary will lead to increased resistance in the pulmonary vasculature or capillary, and that automatically will lead to increase RV afterload. Remember that. So you see, both mechanical ventilation will decrease both preload, left ventricle and right ventricle, but afterload it will decrease LV afterload and increase RV afterload. Just remember this, that alveoli, when they are filled with air, they are distended, they compress the capillary, increase capillary resistance, and this will lead, because the RV has to squeeze harder against this resistance, increase RV afterload. We'll continue next video.